really my pleasure to have as our keynote speaker today Dr. Tony Kuo, Director of the Division of Chronic Disease and Injury Prevention in the Los Angeles County Department of Health and Director of the Office of Senior Health for the County of Los Angeles. He is also an Associate Professor at the University of California, Los Angeles, with joint appointments in the David Geffen School of Medicine and the Fielding School of Public Health. In his government and academic roles, he oversees a broad scope of work, promoting increased access to clinical preventive services among low-income populations. And Dr. Kuo and the Office of Public Health have helped to support this conference today, for which we are really very grateful. This morning, Dr. Kuo will be speaking about the role of public health and brain health. Welcome, Dr. Kuo.
Great. Thank you, Freddie. It's a real pleasure to be here. As I had mentioned to Freddie earlier, every time it's been a while since I've been on this campus, and I keep seeing really wonderful additions to it. It looks really nice. So anyway, the planning committee asked me to sort of open the conference talking about the landscape of basically dementia in LA County, and sort of lay out what the county is planning to do and the effort that we have actually put in putting together a strategic plan for the county. And hopefully that will encompass a lot of the other wonderful speakers that's going to come after me to sort of talk about the different aspect of this. So let me start off with some statistics. As you know, in the United States, the statistics is actually sobering, and much of this is actually going to increase. So approximately 6.7 million adults obviously have Alzheimer's disease and related dementias. 1 in 9 adults are 65 and older. 1 in 3 of them are 85 and older. And we know that by 2060, we're expected to probably reach 13.8 million people. Now, what does that look like locally in LA County? Here's sort of our landscape. And what you should take away from this is that even though there's some differences in projected percentage increase here, if you look across racial ethnic disparities, what it says is that Alzheimer's and related dementia actually is going to impact everybody, every group. Again, if you look at the 10 leading causes of death, Alzheimer's disease and related dementias are actually climbing up. It's at least in LA County, it's second to cardiovascular disease. And in some ways, as we talk about our strategic plan, we will sort of make the connection that even with cardiovascular disease, the vascular risk factors are actually shared among both conditions. Again, wanted to mention, if you plot out the trends, there are clearly disparities by different race, ethnicity group. The other thing to keep in mind is that Alzheimer's disease doesn't just affect the patients. Oftentimes you have a lot of family members and families that are actually providing informal caregiving. And we should not forget that locally, when you think about planning for this condition and what we should do about it, to think about caregivers. There are about 322,880 caregivers in LA County. There's also a number of things that in some of our recent analysis seem to suggest there are barriers in terms of providing caregiving. There's financial aspects and challenges for this group in entirety. The other thing to keep in mind about caregivers too is that oftentimes this is probably an underestimate, as many of us may not identify ourselves as caregivers, even though we do provide some level of informal caregiving to loved ones. So what is County of LA or Los Angeles doing about it? And this is more than just public health. We tend to think of county as multiple departments, including our Department of Health Services, Department of Mental Health, and certainly a lot of our other government planning committees. In the past 3 years, we actually pulled together what we call a Healthy Brain LA coalition. And we have actually put in the work with several subcommittees, which actually many members are in the audience today, to pull together a county strategic plan. This is, in a way, just an initial roadmap to kind of help governments, healthcare, aging services, and many of the stakeholders in LA counties to begin thinking about what should we be planning for Alzheimer's disease and dementia care and support. And if you're interested, if you do the QR code or Google the report, it is on our website, and feel free to read about it. So to give you an idea, this coalition, it took about 3 years, and we were very grateful for all the groups and stakeholders, and we even have a number of community members that actually joined us. As you could see here, the coalition is pretty large. It's everything from aging services to local health plans, to obviously a lot of experts from universities and even from national centers, including like the Ball Center on Early Detection. We wanted to bring all of them together because they are, we needed multi-sector perspective on this to sort of come up with at least a roadmap we could begin to follow. And keeping in mind the strategic plan is a live, living document that we recognize that even though we planned for it for about 3 to 5 years, that it is subject to change, and it's meant to change as more innovations and research come about. So what are the things that the strategic plan kind of came up with? The group actually came out with sort of the 3 initial focus areas. We recognize that down the road we'll probably add to this. So strategic plan focus area number 1, it was can we do something with risk reduction, especially around vascular risk factor? And the subcommittee that worked on this came to the conclusion that if there is one thing we can do well, even if we put our effort to it, is like if we could control blood pressure, basically hypertension prevention or hypertension control, we could probably make quite a lot of difference. And not just in cardiovascular disease, as I have mentioned, but as you know, more and more research seems to suggest that there is a link between high blood pressure and vascular dementia, and even for Alzheimer's disease dementia patients, they often have mixed cases where vascular dementia is also in the picture. A second area that the strategic plan decided that we should look into and focus on is early detection. And early detection, I'm sure other subsequent speakers are going to talk about this. Early detection is important in the sense that if you could detect it, you could screen for it. Early diagnosis actually could, with the latest innovation, tends to suggest that there's opportunities then for prevention, for planning, for basically planning for the family and for the patient themselves. And then finally, the third area, the coalition actually thought that strategic planning focus area number 3 maybe to try to promote advanced care planning. And again, this is born out of a recognition that oftentimes by the time people are diagnosed with dementia, oftentimes advanced care planning becomes too late or is a lot more difficult to do. So I want to leave you with this and conclude with this. Now, in all our work and in looking at the landscape of Alzheimer's disease and dementia and what the county is prepared to do, we recognize is that there are actually still a number of challenges that we as a group and we as LA County will have to address. The scope of work and call to action, for example, in our strategic plan covers a lot of ground. And quite frankly, We probably do not have funding and enough resources at this time to tackle everything. And therefore, that's one of the reasons we started out with 3 focus areas, recognizing that hopefully as this gained momentum, we could get further resources to do so. We also know that the solution isn't just going to have to come from public health, population health, or just even the healthcare sector, which I think oftentimes dementia is sort of thought of in that regard. We will need other partnership, especially from different sectors in society and in the community, to actually move the needle on this. And then finally, one of the things we learned trying to do this strategic plan was how, even though there are data here and there, quite frankly, we don't have the robust data infrastructure that we probably normally associate with other chronic conditions or other diseases that even public health often track. On the other hand, if you look at challenges, we can also think of it as there are plenty of opportunities which we could leverage. In putting together this strategic plan and what the county hoped to accomplish, we recognize that there are probably areas that are low-hanging fruit projects that we could continue to support. One of them, for example, being able to ask Center for Disease Control to kind of help support conferences like this one is actually quite important in terms of sharing best practices and convening people together to talk about this issue. There are also ways in which we could probably convince our decision makers to think about alternative sources of support. This can be done through policy and also multi-sector collaboration. And then, of course, this is also an opportunity where perhaps public health, health services, and university partners can also come together and begin to think about, is there a way to improve our data infrastructure so we could have a clear picture of the landscape of dementia, Alzheimer's disease and dementia data and trends, both locally and nationally. So if you guys, if people are interested in our Healthy Brain LA resources, please visit our website. We also have a table over there too if you guys want to visit. We have some resources that are both for professionals, for the community, and certainly for patients. So anyway, again, thank you for having me, and I really hope everybody really enjoy the rest of the day and the wonderful speakers that will be coming after me. Thank you.